Folded is a storytelling platform to dedicate making an impact. Donations supporting cancer-related initiatives are made to JJ's World. This is a registered 501c3 nonprofit organization. We are proud to collaborate awareness and sponsorship relationships with the Paula Tatic Foundation for Sarcoma Research, supporting efforts to increase awareness, advocate for patients, and advance conversations surrounding sarcoma research, specifically going into Ewing sarcoma clinical trials. We are also honored to have a community partnership with the Atrium Health Foundation, helping amplify the importance of cancer research, innovation, and resources for patients and families. Through these partnerships, a portion of donations raised through Courage Unfolded will support efforts focused on advancing sarcoma research, clinical trials, helping contribute the development of better treatment options and hope for patients facing those rare cancers. Every story shared on Courage Unfolded has a purpose to educate and connect communities, support research, and remind people that no one should face cancer alone. Choosing truth before fear begs you to retreat. Welcome to the Courage family. I am super excited I'm just grateful actually to have Dr. Renata Braudy here with us today. And so really, really happy about that. Hi, Renata. How are you doing?
I am good, Katrina, and I'm excited to be here. How are you?
I'm doing good. I'm doing really good. A long week, but it's been settling down a little bit, and so I'm pretty happy about that. And it's summer in New York, so.
Oh, and you guys just had the Knicks?
We just had the Knicks. It was insane. I mean, yeah, woo! We made history. Well, New York made history. I'm considered not a New Yorker yet. Everyone's made that known. Everyone's like, not yet. You got to be here a certain amount of time. But yeah, I know. I find that funny. I've never experienced anything like that before. I was actually out that night.
Wow.
Yeah, and I mean, it scared the crap out of me. I'm not even gonna lie. I'm not even gonna lie. It scared me. The friend that I was with, I mean, long story short, just was like, well, this is the New York. This is how we're gonna feel the vibration. I'm like, yeah, I think I'm gonna feel the vibration next time from my apartment. Because it was pretty scary for me. Very different, obviously, coming from Vegas, but I was very happy that I think I got to experience one time the New York craziness, but never again.
Yeah.
It was pretty
Cross that
scary.
off your list because it might not ever happen again.
I mean, yeah, no, I'm really
that. I'm a New Yorker. I still am a New Yorker.
Yeah,
so
no, it was just scary. I think you can still celebrate, but obviously me being so new, I didn't know the area that I was in, and so I was actually down at Times Square.
Oh, wow.
Yeah, and when I tell you it was really scary, it traumatized me. Like I was awake till like 6 a.m. Sunday was very not fun for me. I was right there when the gunshots happened, and it felt so close. It actually like made me jump, and I tried to. You just see everyone running, and I actually tried to run in the building behind me, and it was locked, and I was just like, oh my God, I'm about to die. And a girl actually hand got stabbed in front of me. And no, literally, Dr. Renata, it was not a great time for me. I was right there. I was like, I got to get out of here before these buses, because why are these buses in the middle of the road? And like, I was literally right there. It was not fun.
Scary.
It was not fun. Let's just say I'm going to be very different on asking just questions with people, like, where are we going? What are we doing? Yeah. I'm very happy for the Knicks to win, though. Let's go Knicks.
Yes.
Yes. Okay. So let's go and get started. I am going to kind of do an opening. I really want to talk about your work and kind of your perspective on some things. And so
Sure.
I do have my list of questions here. I want to start it off with, however, you've built something, which is, I think, amazing. I want to, obviously, before I actually get started into that, if you want to explain to everyone what you've built, kind of a background about you, and yeah, who Dr. Renata is.
Yeah. Hi. So I am Dr. Renata Braudy. I am I've been a PT for 20 years and over 20 years. And for 20 years, I worked exclusively with breast cancer survivors. I developed 2 programs, one in Arizona, one in Phoenix. There's now over 20 clinics with a program that I helped build. providing services for breast cancer survivors that weren't there before. So that has been really fulfilling. At one point, I actually had let's just say a friend from New York who moved to Arizona, because the first program was in Arizona, ask me what she should do because she was diagnosed. And I said, well, this is what you should do. And you should go to this it's called Spooner Physical Therapy. It was the first program where I built it. She said, oh my God, that's where I'm going. And is that the program you built? And it was crazy, the whole circle, because I knew her when I was a teenager, right? Just a middle schooler. And then she was able to benefit from the program that we made.
Wow.
So I started one here in Arizona too, and then I had an amazing opportunity for my PhD and actually studied shoulder function after surgery and radiation for breast cancer survivors. Yeah, because I had treated by then hundreds, if not thousands, of women with shoulder problems, and no one really could explain what was going on.
Wow.
And I'm the kid that I always said to my mom, like, well, why? And so we'll get into more. But anyway, so I got my PhD in that. And then I started the second program at a local company here called Twin Cities Orthopedics. And they've done an amazing job growing. And we scaled it out to 10 clinics in Minnesota and Western Wisconsin. And then just this year, I left. I wanted to make an impact on a bigger scale. I knew I was talking to people one-on-one, but I knew that there was people all over that were not getting the information that they could use and that they could be empowered by and get some of the control back, because so much control is taken away during cancer. So now I do consulting online, custom consulting for organizations if they want to start some kind of a breast cancer program or provide services for breast cancer survivors that affects work, that affects career, that affects home life and PT time away from work. So we can help them get it back faster. And I also work one-on-one with survivors and really give them a roadmap, because as I'll talk about, the biggest thing, I could just summarize it in one sentence, is that there's a gap between the time that treatment ends, or if you have stage 4, when active treatment continues, and then like the rest of your life. Like you had this whole team behind you while you're going through treatment. You had your checkups, you had your questions, you could talk to the nurse, you could talk to the doctor, you could talk to the medical assistant, you could talk to the person drawing your blood. And then all of a sudden we'll see you in 3 months, we'll see you in 6 months, we'll see you in 9 months. And you're like, wait, like, is my arm supposed to feel like this? Am I supposed to be able to lift something? And people fall through the cracks.
Yeah. No,
So
I just watched a video, no joke, is like, also actually piggyback really quick is, I just learned, and again, I'm starting this platform and I'm doing this, but I'm also learning. I'm also really learning a lot of things. And I say it so much, like, everyone has something knowledgeable and we can all learn from each other. But something I really did not know until my last recording actually was oncologists actually after survivorship, they don't go in on a regular basis. And that's insane to me. Like, I really, again, I'm one person, my opinion, but I really do believe that people that are survivors should be seeing their oncologist a lot more. But it goes from 3 months, like you said, to then, 9 months, and it just keeps getting pushed out more, and there's no structure on what is there after, how your body, like you said, is going to feel after the real struggles. And I've been watching Gabby Cooper, actually her whole story, and she's just got done with her chemotherapy, and she got back into the gym, and she posted a video of her just like laying there crying. And she's like, I didn't even understand how hard it was to even just to do one push-up. And so anyway, yeah, I was just kind of piggybacking off what you were saying. People don't talk about it enough. And so what you have created, I think, is really beautiful, especially because there's just we're not just counseling. You're doing so much more in the sense of like, you truly do care. It's not just about counseling and come talk to me. It's like, you really want to help people, and to leave your position that you were at for so long is so crazy. And that takes real strength, gut, hardship. Like, I mean, I would have had fear. I mean, doing anything new, there's always going to be a little bit of fear. But you did it. And like, how is it going? You started it, what, a year ago?
No. I just started it I resigned January 16th of this year. So I really
January.
just started in February.
Wow. Okay.
Yeah, so it's very recent. It's done amazingly well. So the LLC, the company I founded, is called Empowered Recovery and Wellness. It goes by This Is Empowered on Facebook, and breastcancer.empowered on Instagram.
I will
But
definitely make sure to link all of that as well, guys.
okay, awesome. Yeah, I love that. And I stuck with the word empowered because I feel like cancer treatment, your journey through cancer, so much is taken away. You can't, I mean, you have choices, but like, hey, if I want to live, then my best choice is to have chemo. My best choice is to have a lumpectomy. My best choice, and then the radiation and all these other things. And my job as a PT has been to empower my patients. Here's what we know. This is what you can do about it. These are things that you can't change. These are things that you can change, right? And just giving that power back to people is huge.
Wow.
And I have to say, was I fearful? Yeah, I mean, there's still days I'm like, oh my God, what am I doing? But it has been an amazing ride, even the last month. I've talked to people in Africa this last month, Serbia, New Zealand, Malta,
Wow.
all over the world,
Where's
Philippines.
Malta? Where's that at?
It's right off of Italy.
Oh,
It's right
nice.
off of
Okay. Wow.
Sicily. Yeah.
Wow.
Yeah. I just want to go visit everybody I've talked to.
It's yeah, and I have a question for you. So everyone that you talk to, do you just feel so different afterwards? I guess what I'm like, do you get the same feeling every time, or is it like, I don't know how to answer that or ask that, I guess.
Yeah. I mean, I think it's just really validated, right? It really validated that there is a need for that to fill that gap.
Yeah.
Because I had even on one of the socials yesterday, a nurse write into me and say, I'm a nurse and I work in oncology and I've never heard of radiation fibrosis. And I think that is exactly what I feel. So much of what I'm doing is validating what people feel. I've had hundreds of responses like, was that what it's called? How come no one ever told me that? And I do want to say something to what you said with the oncologist. If they could spend the time and follow up with all their patients, they would. But there's like the next cancer patient knocking on their door.
Yep. And so that's what so by the way, so you're more, aware that was actually an operating, like a COO, what are they called? Chief Operating Officer. And so he flat out just said, like, Katrina, there's not enough oncologists as is. There's not enough, even just the generation that's changing. It's a little scary, is we don't want to work and we don't want to work as hard. And AI is really being inputted as tools and things like that. And just what it's changed even the last 20 years. It's pretty scary. It really is. And I think if we don't start acknowledging and really getting it out and bridging all of these gaps, I think that it's just, I'm going to keep praying, I guess, because it really is everyone's fear. As many people I've talked to is like, hey, if we had more oncologists, if we had more people wanting to go to school for it, like you said, they don't have the time. They're seeing another patient and then they got to go do admin work and then they have to do this. And I guess it's so heartbreaking. And so, yeah, we need people like you to go and do these things. But a lot of people don't know how to step out of that fear, that actually do it. And so, again, I'm not dimming on anybody. There's a lot of amazing people in the world. I think everyone has their role in the world for a reason. And we wouldn't be able to do it without the doctors and the treatment and all of those things. I'm not a doctor. I don't think I will ever become a doctor. I think I will become some side of counselor in the oncology world. I see myself, but I can't do blood. I get squeezy and I just can't do it. And so we need the treatment side of it, but we also need what you're doing. And it's so important to get it out there. And I'm very honored to help get it out there and keep sharing. And hopefully it'll become this amazing thing. And you've helped thousands, if not millions, of cancer patients. And within that, I hope knowledge and all of these things come with it. Because there's a lot that I think we're all just afraid to ask because cancer is so death. And that's sad. And that's really sad. And I've come a lot of people just ask and see where it helps. I think just we're all really nervous because we don't know how. But with like your, empowered, with, your company, I love the name. I never actually, that's like, I never actually, thought of your name as deep, of course, you. And so now that I know that, it just makes me look at even your organization in a lot more light. Anyway, yeah, I ramble.
No, you're good. And a fun thing too, if you haven't noticed it too, is my logo is a lotus and a ribbon. And so the lotus is the only flower that can grow out of the mud.
Wow.
And so I put the cancer ribbon inside of it. So there was very purposeful on that front too.
Yeah.
And the only thing that I know we have so much to talk about, but you asked about how it's going and in terms of the reach and everything too. So the last 30 days, I should have looked at the stats. But the last 30 days, if I could pull it up really quick, it's been over 1 million people just on Facebook alone that have interacted with my
You posted something like that on your Instagram, right? I think I saw
1.2 million at this point.
Wow.
Just on Facebook. So there's Instagram and LinkedIn as well. So it just shows the need. It just shows, oh my gosh, we have this information to get out there and people are really hungry for it. And it's survivors and it's healthcare workers and it's friends. So it's really amazing to be part of that.
Yeah, like I'm like screaming in my inside right now. I'm beaming for you. 1.2 million in what? We're still in 2026. Like since what? February to literally now. That is a miracle within itself. That right there shows you how much of the gap truly. Wow. I'm in awe right now. Okay, so I'm
one more thing.
Yes.
And this is it. And then you asked me. In 2006, I wanted to start a program like this. And I did. But the place I was working said, you will never make this work. I was working at a hospital, outside of the hospital. And so that's all I have to say. Actually, within a couple months, I was in the paper and my friend cut it out and put it on that person's desk. When there is a need, you build it. What's that like? Build it and they will come?
Yeah, 100%. Build it and they will come. And I think that I'm really happy that you said that because I think in every situation, there's been someone who's in just life saying that you can't do something. It won't work. And it's like, watch me. And, watch. That's how I say it.
I'm from New York.
Yeah, like you're from New York. Exactly. Like what? Oh, and when, like you said, if there's a need, it will build. And so it's like, yeah, what? No, I'm going to go and do this. And because there is a big need that people really do not see. And it's been perceived wrong. I really hate that people hate doctors. They do. I don't want to say hate. Hold on. Let me back that was a little harsh. They don't understand. I'm like, that was a little harsh. They don't understand and they don't. And, of course, when someone like a loved one, either A, passes or they just see them going through such a hard, the body and what, chemotherapy does to a cancer patient and all of these things. Cancer is horrible. It's ugly. It is so ugly. And I'm rambling now, but I really do not like the way that people do perceive doctors. And so when there is, a need, it will be built. And so there was a really big need where, like you said, there's a huge gap. And a huge gap. And I say it every single time. I'm like, I don't understand how cancer is the biggest community out there, the loneliest. And so that's been a big question mark in me. And I'm like, why? Why is that? And so now here comes you amazing, beautiful voices to tell me why. Because again, I don't know everything. And so I guess, we're gonna share this to the world, Dr. Renata. We really are.
I love it.
Let's go ahead and
turn. I know sometimes you edit stuff out. I might just turn these. I have some sconce lights because it's getting a little darker.
Yeah, go for it. Yeah, we'll edit all of that out.
Okay, sorry.
No, don't be. You're fine.
Let's see if that works.
No, listen, he's very known because we'll have a cancer patient in here, and they just have to use the restroom, and so they'll just get up and use the restroom in the middle, and so edit. Yeah.
Great.
So yeah, it's great. I love your background. I'm struggling with New York a little bit. Don't get me wrong.
The trees.
Yeah, all the trees. I really am missing a little. I call it Normalville.
Mm.
I've been missing a little bit of Normalville. I love New York. I think it's not for me. People come, they try it. I am not going to be. I'm going to go to like Jersey or like Connecticut, very close to New York. But it's been a journey this last year, and I'm ready, I think, to visit New York and learn it before I can really consider if I'm like, hey, this is somewhere where I want to be and I like it. So I don't really have. I'm going to back my opinion up. I don't really have an opinion on New York yet. I'm going to get there. I think everyone has expected that of me and is like, if you like New York in a year, we're worried. And so they're really like, it's an emotional roller coaster. You'll probably won't like it in a year. You should hate it. You should not. I've gotten so many different answers. Anyway, I'm going to start talking about New York now. I'm getting sidetracked. Back to this. Okay. So the survivor gap. We've been really talking about the survivor gap. So I want to get to kind of the core of your message and what you've been, kind of talking about in the beginning of this. I know that you often talk about the transition point when treatment ends, but care doesn't continue in the same way. What typically happens to patients in that transition?
Yeah, it's a great question. We talked a little bit about that. We touched on that just a bit ago. But again, I think what happens is there's a plan, right? There's a plan, there's the diagnosis, there's your treatment plan. You're going to have chemo, and then you're going to have surgery, then you're going to have radiation, then you're going to have hormone therapy, then you're going to have Herceptin for a year, whatever your treatment is, and it's always changing. And you have people by your side all the time. How are you feeling? What are the side effects? Let's check your blood, make sure everything's okay. Oh, you have a pain right here. Let's check that out. Okay, no, it's just fine, right? Just some scar tissue. And then you ring the bell, is what they always say, right? You ring the bell and your active treatment's done. And then you walk out and it's kind of like, now what? Like, where's my roadmap? Who do I talk to if I have this pain? What's this thing running down my arm?
That's what happened to my brother. It's just so crazy that you're saying this right now because that's exactly what we had. Again, I don't want to play a victim in a sense because we're not. I think that I had the authority to maybe go on the internet and check about relapse. I was very unaware about a relapse in Ewing sarcoma. I had no idea. And so we were really told from our doctor, like, do not go online, do not check online. My brother had pain in his arm for a month. And we thought that it was just, the doctor was just like, oh, it's probably just from chemotherapy. And it was not. So for a whole month. So anyway, I just wanted to piggyback off what you're saying. Like, I'm really resonating with what you're saying because I went through that in that exact thing. He had exact pain in his arm. And we had no
idea. It's a common story, Katrina, which is why I say that, right? Unfortunately, it happens a lot. And I mean, for me, I don't catch new cancers very often. That is not my job. Once in a small while, I would see something and just say, you need to go see your doctor. I stay in my lane, right? 100%.
Yeah.
But what we need to do, and what I think we're going to talk about a little bit later, is there's a plan during active treatment. We need to have a survivorship plan. And that is in place. So some of the national cancer certified centers have a survivorship plan, or supposed to, but only in one study I saw only 45% did, right? Or were carrying them out.
Wow.
So yes, and there's a lot of studies out there with a lot of different statistics, but I'll just talk about the one that I saw.
Right, you're like,
I've never worked in one, but the point is, if that's a cancer certified place and they don't even have a survivorship plan, I think that most places don't have one. There's the checkups, and it's great. And the doctors, I have to say, the doctors and the nurses and the medical staff do as much as they can. But like I said earlier, the next person's pounding down the door, right? So that's why we have to have a whole other survivorship team, ideally, is what we need to provide for those patients and those survivors.
Do you think that, like, how do we bridge that gap? I guess what I'm saying is, like, how do we get, I feel like there should be something in the hospitals and within these doctors that, like, have a resource for survivingship. Like, I really have never, right, like, where is those resources? And again, I don't know, maybe they're there and I have been blind to it, or maybe just, again, my experience, I didn't have it. Everyone's experience is a little bit differently, of course. And so I wonder, maybe you don't have this answer, or maybe you do, is like, why aren't they in the hospitals? Why aren't these all mainly in there to give to these cancer patients? And again, that might not be an answer that you have, and that's totally okay.
I don't have the answer. I will say that, of course, it costs money and it costs time and it costs space, right? And I think everybody wants it. I think in the beginning, historically, and I'll go back like 20 years. So I've been doing this over 20 years, right? And I've had so many women say, I should just feel thankful. I just feel like I should feel thankful that, you know, I got diagnosed and treated and there's no evidence of disease, or it's stable and nothing is growing. I don't want to complain about anything else. So I think part of what I do is I empower survivors to be like, hey, and that's why it was so intentional, right? If your arm hurts, it doesn't have to. Why don't you ask? That pain in your chest, that's probably nerves. Let's teach you what it is and what we can do about it, and ask. So if we empower patients and they're starting to ask for it, and there's a whole big research thing going on now with exercise oncology. So there is a lot of big steps being taken. But yeah, we can always do better, right? That's what we're all trying to do.
Correct. No, I agree. I just thought, again, I just like to ask the questions of like the people don't ask. And I'm like, I don't know. I'm asking because I don't know. And I think I'm happy that I asked that, because I think a lot of people need to hear that, you know, because again, anger and emotions, and we can get really emotional when it comes to people we love, for sure. Yes. And our mind can really get bottled up, and especially that fear of going through cancer. And then afterwards of like, oh my God, I made it. Is it going to come back? And like all of these things. And so I think that a lot of people really need to hear what you just said. And I think a lot of people are going to resonate with it. I did. And so thank you for that. We need to hear it, because, you know, I'm also human. And sometimes I'm like, I got a little bit of questions and some things that I'm so confused about. And again, that's another reason is to bridge the gap of the cancer awareness and everything. And so I'm happy that you came on and there we go. I'm a rambler.
All good.
Let's go ahead. Let's see. So in your experience, we kind of answered this, but just to bluntly ask the question, because someone did tell me to ask this. In your experience, what gets missed most often when patients are discharged from active oncology care? I know that you kind of answered, you basically answered it, but I think to a T.
Yeah, I think the plan, right? If you have questions about how to get your strength back, let's get you set up with a trainer or a nutritionist, dietitian. If you have tightness, pulling, pain, weakness, swelling, let's get you set up with a PT or OT. You know, having a game plan. So, because I think sometimes, to reflect back on what you said too, you know, why doesn't everybody have this information? Everyone should have this information. Oh my God, when you're going through cancer and you're like told you have cancer, but wait, you have to get your kids to baseball, and then you have your job you have to think about, and you have your mom that you have to take care of. And it's like, you don't have time. What? I may have like this thing called courting. Like, I don't care. Let's just get the cancer, right? So at some point it's too much too soon. So the hard part is that everybody's different too. But I think just having resources available and saying, this is a plan, keeping it really simple. Here you go. If you have a problem, call these people.
Right. Wow. Yeah, it's that simple. You're right. You were so right in the sense of the cancer comes, and I think the main thing that I have been hearing a lot is everything happens so fast. You get diagnosed, you got to go to treatment, and I've been seeing so many TikToks, like, they're kind of angry that they have to go through treatment, and they're like, duh, of course I got to go through treatment. Like, what else? I got to survive cancer. And so it's just so funny how people are really perceiving it without really explaining the back end of things. And so I think this is like a wonderful episode that I really wanted to record, because I knew during our intro you're very real. You weren't going to come on here and give me some bullshit answers, and you have it. And so I admire that. I thank you for that. And so many people need to hear it. And we just don't want to ask. It's really hard. It just all is happening really, really, really fast. And it's scary.
Overwhelming. It's overwhelming, and it's scary. And especially when you're done with active treatment, I mean, come on, like you've had like 2,000 visits and how many medical bills? Do you really want to make another appointment to see a PT?
Oh, yeah. Yeah.
Right?
No, I get it. I
But
get it.
just to know it's an option
Yes.
is
And
huge.
you've made it there that far. And I always like to tell cancer survivors is like, you've made it this far. You have a power that nobody else is walking in. You know what I mean? And own that.
Mm.
And there's a power to survivors. It's not just like, oh, I beat cancer. Like, there's so much to it. You beat your mental, you beat your physical body, let alone everything that came with what cancer destroyed, you beat. And so it is so, again, your name, empowering to be a survivor. Like, it's such a good name. Like, I'm like, wow, right now. Like, I love it. I love it. You really put heart into what you're starting and what you're building and what you have. I mean, 1.2, that is a blessing in alone. I mean, that's a lot of people. I mean, there's millions of people, but for you to even reach that many is
In a few months, honestly,
I
it's mind blowing. It's
mind blowing.
mind blowing.
I really, I'm trying to wrap my hand around it, and I see so much, again, success in the sense of how many survivors you are going to help and the power that they walk in. I admire it so much. And the ones that really take their surviving cancer and make it into a story and make it into other things, that's what real life is about. I think all the other stuff is like, yes, we need a roof over our head. We need things and the stuff that comes with life. But again, that's not what's important. And I think the people that survive and can walk in that have the most power than any CEO or any of these titles and all of these things, and they don't even realize it. And it's such a beautiful thing. I'm like getting chills right now. Anyway, it really is. It really
I
is.
love your passion, Katrina.
No, it's so much. I don't know where to put it. And I ramble, and I think I get so much sidetracked because there is so much passion. And I've never been able to lose that. Everything that I've been through, I mean, I can't. I don't know how. I will scream. I will shout. I'll have my moments. I don't understand a lot in my life that's happened. I really don't. But I've really come to the senses of like, man, I survived in a way. Again, I didn't have cancer, and I'll never perceive that. Never. Gosh. And I hope I'd never do. But I want to walk in that light for cancer patients and that realness and show them like you can be powerful. So yeah, I thank you for that. I know that you've mentioned fatigue, and functional limitations being misunderstood. Why do you think these symptoms are still under addressed in the clinical setting? I like this question.
Yeah, this is a great question. I'll put it to you this way. People that are in oncology care and oncology rehab, they know this stuff, right? This is when I talk to them, I'm telling them what they already know. But the rest of the world, which is most of the world, doesn't know it. So if I ever treated, like my fiance, he had knee surgery last year. And I was talking to his doctor, and he's fine.
Okay.
He's hiking Mount Kilimanjaro with us, actually, in July. Yeah, so he's fine.
Yay! You're
But
like,
anyway, so when I was talking to his doctor, and his doctor asked what I did, I said, look, if I was his PT and I never looked at or worked on his scar, said you would kick my, fill in the blank, fill in your favorite adjective, right? Or noun. So why is it any different, right? So one of the first people that I treated when it's a breast surgery, I should have finished my sentence. When I started working in clinic and started specializing in this, I had a woman that came to see me. Now I'm talking about why orthopedics doesn't see the oncology side. And I had somebody that came to see me because she heard I worked with breast cancer survivors. So she had seen 2 therapists before me. And I checked her range of motion. I checked her strength. I did all the things that a normal PT does orthopedically, which is all correct. Then I stepped out of the room and gave her a gown, and I told her to put on the gown. And when I came back in, she was crying. And I said, okay, I know this is really hard. She said, no, I don't even have breasts anymore. I'm crying because you're the 3rd physical therapist to look at me, and you're the first one to look at my scars. And that just blew my mind. Because like I said, if I didn't look at a knee scar or an ankle scar, I would be reamed out. But this person had seen and gone through 2 full courses of physical therapy, and no one had looked at her scar. And simply put, if the scar isn't moving, the tissue around it isn't moving. If the tissue around it isn't moving, then the shoulder isn't moving, right?
Wow.
So we fixed her scar mobility, and her shoulder got better.
Everything else.
Everything else moved better.
Wow.
So I actually have a framework for this that I teach when I consult with companies and clients. And it's called the breast cancer lens. That's a little insight there. And when I teach it, I teach people to look through that breast cancer lens. What are the side effects of the treatments, the oncology treatments that they had? Because it's not just a shoulder. It's not just an orthopedic shoulder. It's an orthopedic shoulder with radiation changes, with scarring, with altered posturing, with weakness from deconditioning, with weakness and altered muscle length and tension ratios because your shoulder's forward because you don't want anyone to know or anyone to touch it because it's healing, and then you stay that way. So there's a big disconnect there. Orthopedics does a great job at orthopedics. Oncology does a great job at oncology. But it's when you blend the two that we have to help them talk to each other. And that's what I try to do.
So you think it's like, no, that makes sense. Kind of like a lack of communication in a way, right?
It's a lack of communication.
Yeah. Wow.
I have one other example that shows that really well. So when I was a PT working quite a few years ago, and the best PT for shoulders, again, because I mostly did shoulders, only breast cancer. He saw somebody that had shoulder pain, same thing, history of breast cancer and a history of non-Hodgkin. So she had received mantle cell radiation before.
Wow. Okay.
And she said, I saw this guy, but he said my shoulder joint was fine. My shoulder was fine. But then he said that you work on this and he doesn't work on this because he's a guy. And
Okay.
I was like, yeah, I work on this. So I got her in my room. I put on a gown. And again, same pattern. Tight on the front, weak on the back, altered posture. Within a few months, she was back to biking, pain-free.
Wow.
He saw the shoulder joint. The shoulder joint was fine, but what was surrounding it was not. And that's what was causing her pain.
Wow. That is amazing. Like, you can see how much you care. And that alone, I mean, that gap right there, that's something so simple as a miscommunication in a way. I don't want to say miscommunication, no communication, can change so much. So much. And again, I think
and PTs aren't taught this. They don't know the effects of radiation and surgery. And well, they know surgery, but the radiation, the chemo, the neuropathy, the fatigue, the chemo brain. I mean, I could go on AI.
Everything. Everything. And I really, that's why not one person can do it all. And I think people really need to understand that, not that one oncologist knows everything and can do everything, it's one human. And, yes, what they seem to knowledge themselves on and what they want to learn, but at the same time they go to school and they have a passion for what they're doing. And that's why they become either specialized in certain things. There's different oncologists from non-Hodgkin lymphoma to breast cancer to Ewing sarcoma to Hodgkin lymphoma to brain tumors to, you name it. And so it goes back to that big old check mark up here is the communication, the asking, the whys, and just asking questions. And it goes back to, I can't wait to I would love to, even after this, like in the future, schedule like a call with you, because I love, truly, it's giving me so much empathy is what I like to call it. I think that's why I keep my empathy is stories like yours. That girl coming in and crying and she's like, look, I've seen 2. And you're the first person to actually look at my scars. Like, that's empowering and that's shocking within itself. And that just shows me it's like empathy of like, again, me as a person and the way I walk. And like, I'm grateful for people that truly do care, especially now in today's world, and asking those questions and bridging those gaps. And I'm happy with even those 2 girls. Like she's riding her bike now and doing things. And that is beautiful. Like, I know that we can't help everyone, But I say it all the time. If you can just help one person, you know, you're doing something right.
The
And
starfish
so,
story. Do you know the starfish story? You have to know this.
no, what is that? What is
Oh
it?
my God. I was
What is
trying
that?
to decide if I would name my company that. So there's an old man and a
I'm
little
sure
boy
every
walking
someone
along the
will know it.
beach.
Yeah.
I love this. I grew up going to the ocean, so I love this story. Anyway, there's starfish all over the beach, and the little boy kept stopping and picking up a starfish and throwing it into the ocean. And finally, the old man looked at him and he said, "Why are you? There's hundreds of starfish out here. Why are you throwing them into the ocean? You're never gonna get all the starfish." And the little boy looked at him, picked up a starfish, threw it in the ocean, and he said, "It made a difference to that one."
Yep. Yep. Beautifully said. Wow. I did not know that. Now I'm going to like remember that story forever.
Yeah, it's a
It's,
great
yeah.
story.
No, that's a great story. That's like a very beautiful story. I'm like really sitting in that one. Yeah, beautiful story. Thank you for sharing that. I'm like looking at the wall right now, reminiscing it. Jesus, Katrina. No, it is because I say that too. If I can just help one person, I really could.
Yeah, yeah.
I'm doing something right. And I don't know why. I think I know why part of me created Courage Unfolded, but I think as I've really been doing Courage Unfolded and recording episodes, it's been so many different emotions. And now I'm sitting back and I got to record my episode because I'm like, I did it wrong. And like, I don't want to say wrong. I've learned so much and it's taught me so much. And I'm thinking, you know, I can sit here and go, I think Courage Unfolded is to be started either giving someone healing, whether it's helping someone with grief, knowledge. I mean, there's so many things that I think the podcast can help. And I think it's really also helping me in my own healing and my own. I mean, it's just there's so many beautiful things coming out of this. And if this doesn't go anywhere or whatever, like I've learned so much in just the series that I've created. And I couldn't be more grateful for that. And this is knowledge that I'm going to take for the rest of my life. What you've started, I'm going to know this forever. And so if anyone ever comes to me with breast cancer or anything, I mean, I know someone right now and I really can, why have I not thought about sending her your website? Because she's going to beat this. Like she's already 8 out of 17. I'm praying she's going to beat it. I speak that every cancer patient's going to beat this. And so I'm going to send her your way because I think that she can be very beneficial when she does beat this. And hopefully.
Yeah.
Yeah. So,
Well, thank you for that. And it is what I do, I get back, right? I get back so much. I have met incredible, amazing women, and have been able to help them at a really difficult part in their lives, and men, right? Because men get it too, although it's much less frequent. It's 1 in 8 women, if people don't know that. And 1 in about 750 to 800 men, depending on the stats. So
I do not know.
it's really common. And you asked earlier, what's the disconnect? I'm like, if 1 in 8 women has breast cancer, and you're seeing people for breast cancer in your training gym, or sorry, you're seeing people for like shoulder problems in your training gym or in your orthopedic clinic or wherever, chances are probably 1 in 8 of them has a history of breast cancer. And it gets completely swept under the rug. Because when I was a new grad, I would hear someone had cancer. I'm like, oh, is it good? It's okay. Everything's under control. Awesome. Okay, let's move on into your stuff, right? Because it's scary to ask those questions. And
Yep.
I didn't know about the radiation and the cording and the chemo and the blah, all the side effects.
Yeah.
And that's what gets missed.
Yes. That's what I was about to say, as most don't. Like you said, is that's what gets missed. And I'm hoping we can bridge that. I mean, you already are. You already are. And so, man, I can't wait to see what this is going to look like in 10 years. I'm excited. Like I am so excited, and I'm not kidding. I'm literally going to send it to Hannah right after this. That's her name, Hannah. She's battling triple negative breast cancer as of right now.
Yeah.
And
And a
so
friend of yours also young.
she's young. She's 29. Her mom had she's going to be on the series, and so that's why I'm kind of talking about her, because I'm sure
Fun.
she
Yeah.
wouldn't mind. Yeah, I'm
Great.
positive she wouldn't mind. She's an amazing, beautiful, soul, and I met her in person, and wow. And you'll see it even in the episode. I mean, she's just a beaming light. It's insane. But she even just flat out, like, so hold on. Her mom got diagnosed when she was young, about 10 years ago, and her mom actually passed away from metastasized breast cancer.
Sorry.
And so she's going, through triple negative breast cancer now as she got older. And she, to me, is a walking story of don't let that fear. She was supposed to get married. And so she had this big old, I mean, you'll hear it all, but she had this beautiful wedding planned, and they still did it, but they ended up changing it into like this bar and just getting, they planned a wedding in like 3 hours basically. And she's just been such a empowering light in the cancer world, I think, and how to perceive it. Again, there's those ugly parts that's a little hard to show. But she just flat out said, Katrina, I just wish people would ask. I just wish people would ask and just not stare at her. Or I think it makes, when people don't ask, I think it's making cancer patients a little more scared of like, am I going to die? Or people that really sits in her head, I think, is what she was saying. Again, everyone's a little bit different, but she really does wish people would just ask her, why can't you eat? She said, I feel like I can't eat because, the chemo swells up my throat and it's really hard. Something I didn't know. I didn't know chemo can swell up your throat. We're over here like, eat, you gotta eat, you know what I mean? And I feel like, man, I feel so bad now. I'm over here like, I didn't even know that because I was so afraid to ask. And we just don't understand. And so I'm really hoping this is going to bridge so much of that and the knowledge, and people are really going to start taking that step forward and being their own health advocate and all of these things. Again, we can't make anybody do anything, but we can definitely put the platform out there. We can definitely, like you, build the organization and be there for people. And you're just a light. You're amazing. Yeah. So I literally you're amazing.
On one little thing you said was about, people don't know what to ask. And this is something that personally I have to think about too. I have 2 dear friends right now that have advanced cancer, different kinds of cancer. Within the last 6 months, they've been diagnosed, right? And you don't know what to ask. Like, if you need any help, let me know. But that's not an ask. I will be here right now to tell you what these people need is, my neighborhood was amazing. And for a certain person, what we did is we put together a fund and we got the yard taken care of. So I'm thinking about the yard all summer. We got DoorDash and a meal train. And here's stuff that we're going to do for you. You can always tell us to stop. But when you ask somebody, hey, just let me know what I can do, it's almost putting another burden on them. So for anyone that's listening that has somebody that has cancer, if you know them well enough to know something that would make their life a little bit easier,
just do it.
Just do it.
I like that. I like that perspective. I really do. And you're so right. I think, again, something that I don't know, something that you've have more experience in with. So that's actually really good. I want to consider that as advice. I think that's really good advice for people that don't know what to do and don't know how to ask, because it is uncomfortable. Even just watching them in so much pain and what they're going through, it's uncomfortable. And you couldn't have said it any better. So where do you see the biggest, I guess, it's, no, actually. So you worked at the intersection of a PT, oncology, rehab, and education. What clinicians, I don't even know if I'm saying that correctly, constantly get wrong when they treat survivorship as a standard rehab? Yeah.
Oh, yeah. So I touched a little bit on it earlier. I think it's when you see the orthopedic shoulder, for example, as you see somebody with a shoulder problem come in and you treat it just like the orthopedic shoulder, right?
Yeah. Yeah.
Or here's an example. I have a dear relative who has since passed. She had breast cancer metastasized. I was actually giving a lecture to a university in Arizona. I had visited her, wanted to stay, had this guest lecture to give. She said, go. We pretty much said our goodbyes. I gave the lecture. I walk out and I had a text that she had passed while I was giving a lecture to college students about cancer. Which was crazy. But this was part of her story, is that she said that she had metastases, which is, when it spreads to your bones. And she had it in her ribs. And her therapist, because they did not know the oncological side or the cancer side, was giving her all these core stabilization exercises laying on her back. But that put pressure on her ribs. right? So I think, again, it's just the education. Here's another little tip. A lot of people don't know if you have radiation on a certain side, and radiation is my bandwagon. Again, that's what I did. Part of my PhD was focused on that. We recommend you don't get a thoracic manipulation, like a chiropractic manipulation in that area, because you can get rib fracture. So that doesn't get passed. And I've seen countless rib fractures over the years for that.
That's so
So I think
sad.
it's really just therapists don't have the time, and trainers oftentimes don't have the time or the knowledge. And again, I'm trying to change that, right? Oh my gosh, if we could get people the care and the whatever the care they need, but they don't have time to ask, okay, well, like, why does your shoulder hurt? Oh, you had breast cancer. Okay, but it's fine. That was 10 years ago. Shoulder problems, up to 76% in breast cancer survivors within the first couple of years. 50%
Oh, wow.
10 years later. So these are things that last.
Yeah, I mean, ongoing things that like, I'm just, wow.
Yeah,
Wow.
and that's just one, you know.
I'm so sorry for wanting to hear about your friend and her passing. You know, my
Yeah,
heart is just,
thank you.
but again, that's, and hey, you're sharing her legacy right now. And so it's just so crazy how people can really leave an impact. And so it was beautiful. And thank you for sharing that. What was her name?
Sue.
Sue. Well, I am going to like just amazing. So Sue's legacy is out there. And you just shared her story, and I'm sure a lot of people are going to resonate with Sue. So thank you for that.
Yeah.
I am just, you're right. I think it's, again, it goes right back to that asking and that lack of communication and not that time. I really want to figure out, though, how, I know that you said because of the time and money, but how can we, and I hope eventually in time, you know, in the future, we can really start getting these resources in hospitals. You know what I mean? I really do. That's what I want, so that we can even continue to bridge the gaps. And I'm going to manifest that. I'm going to speak that now. I think that's like going to be the main, I don't want to say the main goal, but one of the goals. That I really want to try and get all of these resources that I'm even learning with Courage Unfolded into hospitals. And how can we continue to spread the word and make, I think, everyone's job a little more, I don't want to say easier, but easier. I really can't think of the word, but there's no reason that the therapist has, again, they don't have the time. And so if they just had the resource, it would bridge all of this. Of course, is why we've just constantly keep repeating it. And it's a constant repeat. And hopefully one day everyone is going to just come together and we're going to get all of these resources in the hospitals and really make a change. I think a change, that comes in now healthcare. And it's going to bridge so many other gaps besides the why and the questions that we don't even realize. And so okay, so I think, tell me if this is the same question as, I don't think it is, but it could feel like it. Where do you see the biggest disconnect between oncology teams and rehab movement-based care?
Yeah. Another great question. So oncology teams and rehab movement-based care. Again, I think a lot of it comes down to side effects of treatment. What I was referring to when I was talking about somebody with the arm, when you told me about your brother, was something called cording. And it's because you had lymph nodes removed, and then you can have this thing that feels like a guitar string pulling down your arm. And I've had so many orthopedic therapists, because it's not an orthopedic thing. You don't see that if you don't have lymph nodes out, for the most part. You could see it in some elite athletes. But if you don't know what that is, first of all, the patient, the survivor, is really scared. What is that thing down my arm, and why do I feel it there? You know, and your mind spirals. The therapist could just say, oh, that's something called cording, otherwise known as axillary web syndrome.
And that's
right?
just,
It's normal. It happens in 40 to 70%, average of 50% after surgery with lymph node, like when they take a lymph node out, which they do for almost all breast cancers right now.
okay.
And it limits motion. I published a study a couple years ago where it actually changes how you move because there's tension, right?
Okay.
So like that's an example.
Why they take out the lymph node?
So if they take the lymph node, they're not exactly sure why it happens.
Why is that? If they're now, okay, so go on. Yeah, my bad.
No, so they take the lymph node out because what they do is they inject a dye into the breast where the tumor was, and then they trace to see where it exits. And that exit is called the sentinel node. And they can use a couple different methods for that. And that sentinel node, they will biopsy. They take it out to see if cancer cells have spread outside the breast, because that's probably going to be the way it goes. So if that's negative, they're like, great. That tells us that your treatment regimen can be A, B, and C. And if they find cancer in the node, then they think, okay, this has already gotten out of the breast itself. Now your treatment needs to involve this.
Would they now consider that? So let's say if it hasn't obviously passed, that would be just a like localized diagnosis, correct? And then obviously if it has, then that they consider that as like a metastasize.
No, so if there's cancer in the lymph nodes and it just never got past the lymph nodes, you can still be stage 2, stage 3. You can have positive lymph nodes.
Okay.
Yeah.
See, something I don't know.
Metastasize is usually BBLL, bone, brain, lung, and liver. That's where breast cancer metastasizes to most commonly.
Wow.
But yeah, for example, like people, if you don't know what that is, or lymphedema is a huge topic. We could talk the whole time on lymphedema, right? It's that swelling that can happen again when lymph nodes are removed, and we don't have a cure yet. So once you have clinical lymphedema, you have to manage it the rest of your life. So I've had people tell me, God, like it's worse than the cancer. And those are not my words. I want to be clear. It's a patient's words. Because they're like, everyone can see it. Everyone can see I have to wear a sleeve for the rest of my life. I have to manage this the rest of my life. But what's really cool is now we know that we can reduce the risk of lymphedema by up to 40%. By guess what? Like education. By me teaching somebody or a therapist teaching somebody, these are the early signs and symptoms, and this is what you do. Wow. So I published something in 2018 that was 1 page. It's called the LEAP, or Lymphedema Action Plan.
Is it still?
Yeah, it's published. And I share that in my training. But it's published so you can access it. And really it just tells you green light, yellow light, red light. Green light, this is where you should be. Yellow light, this is happening. These are changes that you're noticing. You know, this is what you need to do. I'll go back for a second. Green light also says these are things that you can do to reduce your risk of lymphedema. And then red light is when you need to see a specialist and go see a doctor. So it's really a 1 page. My son had asthma at the time. He had a great action plan, helped me figure out what to do when and what medicines to give when, because I don't know asthma. And I was like, where's the action plan for lymphedema? So I made one, right? But back to the original question, because I digressed.
In that beginning, you said plan. You know, it kind of, I just keep hearing that word plan. So yeah. Wow.
Here are tools. Here's are things like do we know everything? No. But this is what we do know, and let's help you with that, right?
Yeah. No, 100%.
And I think the oncology versus orthopedic, there's a lot of just education that needs to bridge.
It needs to be gaps. It needs to be bridged. Is again, doctors, take this how you want. I'm not trying to be any type of disrespectful. I do understand they don't have the time, and you know, that's fine and all, but then we really need to be speaking as humans. And as, you know, as the orthopedic and the oncology side is they go to school to be, you know, a certain type of doctor. You know, you guys go and you guys know about that, but there's evolution and there's change. And there's so much of that, especially just throughout the year. And if you're not willing to, as a doctor, to, it's going to be really hard to say. If you're not willing as a doctor to want to educate yourself and want to do those things, you're going to constantly see this gap. Because there is change and there is evolution. And I mean, even just within, like you said, there's no cure, but there's a 41% increase, which is beautiful and amazing. I mean, at least it's not, you know, 10%. And so it's just going to keep going. And there's so much tools and, again, evolution that is going to keep coming. And so I think if we can really bridge that, where fine, if they don't have the time to really go and learn the new things all the way, well, then let's start talking. Let's start talking, because I can't just do it with just the podcast. you can do so much with your organization, but you're always going to need to learn, Dr. Renata. You're always going to need to keep filling
Always.
yourself and doing these things and talking and learning. And I just think if every single doctor was willing to do that, it would truly bridge so many gaps. I'm not saying you need to go spend hours on hours and go to conferences and do these. No. Yes, what you learned in school is still 100% what you need to know. I mean, that's what's treating cancer. But if we want to really go for a change, then all of our brains need to, not mine. I'm not a doctor. I have no idea. Don't ask me. No. I'm going to direct you to a doctor. And so I don't, that's not in any disrespectful way or anything. I just really, if doctors, some of them, whether it's greed, non-greed, whatever it is in this crazy big world, if we all just really talked, or the ones that wanted to talk, I hope that they continue, like you and others. And I know, and I'm just not a negative person, especially after, losing a brother. I don't want to perceive as negative. And I really believe that if doctors could, they would. And I want everyone to hear that. If doctors could, they would. And I repeat it again because I hate how people feel about doctors. I do. And if little did people know how much they're trying and the work that goes behind it all, it's so much. But if the doctors were just willing to talk,
I know.
Don't go in and go, hey, by the way, we have, I've been really colliding with this, as they go in and even when they can no longer help a patient, they go in and, oh, we're putting you on hospice. And it's like, wait. Yesterday, we had a whole plan. What happened? I think if we just brought back that empathy in everyone, that alone would bridge a huge gap. Again, a doctor, if that doctor has nothing they can do anymore for that patient, I understand. The only way in their plan and what they know and what they've learned through their schooling is you got to go on hospice. I can't do anything for you. But I think if we switched it a little bit, again, this is my own personal opinion, if we switched it a little bit and went into that, patient's room and really just sat down with them and was a little more humanized and, hey, I'm not saying this is the end for you. You can 100% take everything that you've, have, your test results, all of that, chemotherapy, whatever you've been through, whatever we've done, and take it and maybe go find someone else that's willing to treat it. But I am no longer being able to do that for you. I think that would really give cancer patients a little more of it's their choice. For a doctor to come in and put someone on hospice or whatever, I really feel like for a human, it's taking that choice away. And it's really making that cancer patient go, I have nothing else. And if we just perceive the empathy and the communication just a little bit better, I think so much gaps will be bridged. I think a lot of patients, a lot of families, a lot of siblings wouldn't be so angry that, that person, that cancer patient got put on hospice. Because again, it gives us that choice. And why do doctors want to become doctors? They want to help. They want to help. And as you go through school and you start learning the science part of things, I think they really do lose that empathy. And that's my own opinion, of course. It doesn't give anybody a right to go in anywhere and just say, you're going to die. I don't believe that as humans. We as humans should not have that authority because we shouldn't and we don't. I don't think God created us that way. I don't think that's not us. They go to be doctors. They want to treat. They want to, treat that and that plan. I don't know how I got on that, but I totally just rambled. That is my own opinion. Everyone, some people are going to agree, some people aren't. But I really do. It's bridging, again, that communication, that gap. And from the orthopedic side to the oncology side, if they just had a little more empathy and even just their work alone and the difference and colliding together, I think it would really make a huge difference. And of course, it's just me speaking on the other side of it and not living through it every single day. But there's a lot that feels that way.
You went through a lot. Sounds like with your brother, it was very, Yes,
I mean, it
went through an easy journey.
It was a journey, yes, but I also, even just stories that I've been hearing as well. Even stories and I'm not saying that all doctors, do go in and just go, hey, I'm no longer going to treat you anymore. You're going on hospice. But there's a good amount. I want to say more than half. I kind of like to put it as 30% of those doctors come in and they never lost their empathy. They really, like you became a PT and the things that you became, but you never lost your empathy, Dr. Renata. I can see it in your light. I mean, you wouldn't have left what you did for so many years. You wouldn't have. And there's that 30% that's is the ugly part, I guess is the best way to put it. I don't really know how to put it. But there is a good, no, I want to say the 30%, sorry, is the good part. And then the rest, I think, have really, yes, lost their empathy. I think a lot of people do have experience, and there's millions of stories, and everyone that I've talked to have experienced the same thing. Especially being told, hey, I either can't treat you anymore, or hey, you're a survivor now. Boom, come in every 3 months, 9 months, kind of where we're talking the other side of it. And so I think there is two different sides, whether you don't beat cancer or you do. That bridge of the gap of the empathy. I think a lot of people go through it. Yes, I have been through a lot. Yes, with my brother, 100%. It wasn't the greatest time. I don't think it's gonna be great for anyone when they tell you there's no longer nothing we can do for you.
That's hard to hear no matter what.
No matter what. Yeah, like no matter what. That is going to be a really hard thing to hear. But I think the way that doctors are perceiving or just saying it is very harsh. We are still human. This is real. And just because people get diagnosed with cancer doesn't mean that they don't have the emotions behind it and the fear and everything that we've been talking about, that comes with it. It still exists. And I know that doctors know that. I know that people know that, but we just don't talk about it. And in today's world, we're talking about it now, and we're going to continue to talk about it. And I hope that it goes out there. Anyway, I definitely rambled.
You're good. I'm going to see if I can turn the slide. I was supposed to be talking somewhere else, and it's getting
No, you're okay.
Just a second.
Okay.
Probably the best I can do. Sorry. We had a water leak, so I had to switch places.
No, you're okay. You're okay.
I want to tag team a little bit, though, on what you said about the empathy, if that's okay. So some people know, well, all of my patients know my story, but I have not had cancer. One day, maybe, I run about I think it was like a 35% risk. So it's 1 in 3 because of things in my family. But I know what it's like to know something feels off and wrong and hurt and be told that it's all in my head. Yeah. And be told that I'm making it up. And I had Lyme disease in high school, right? We didn't know what it was. It went undiagnosed for a long time. When it was finally diagnosed, it wasn't treated great because we just didn't know enough about it. It was so early in the disease, right? So I went to run D1 college, pre-med, right? I was trying to run on the team and my knees hurt and I was exhausted. And I was told, it's in your head. There's nothing wrong. You're just a freshman. You're just depressed, right? I am not equating it to cancer, but what I can equate it to is the fatigue that was so much that I couldn't walk down a hill without taking a nap.
Wow.
Right? The knee pain that was so bad that I went from running as long as I wanted to having to hold onto a handrail to climb upstairs. And I'm not saying this to be like, oh, poor her, pity her.
No,
what I'm saying, is that it taught me, because I was that person who was like, oh, are you walking around the track? You should run. Like, I was the person that had no empathy. I was the person that was like, yeah, just do it. And then I became the person that couldn't do it. And because of that, I decided to turn that into this passion that you hear to help others when they say, I mean, gosh, there's so many things, but like this post-mastectomy pain syndrome is one thing that I talk about, and it can be treated in different ways, and it's a tricky one. And I've had so many women say, oh my God, is that what that is? No one's ever told me that before. I've been living with that for 10 years, and my dog knows when I get very...
He's going to give you a kiss over there.
When I get very passionate.
But yeah, I see what you're saying. It's not relate, obviously, but yes, you can relate to some sense of you've been that person. I think we all have. And it takes a real strength woman, even just person, to sit there and go, I was that person and I did that. And I had that ugly inside of me. As we all want to sit here on our high horses and the passion, and I could sit here, but I did the same thing. Thing until, guess what? My brother was diagnosed with cancer. And, I hear it all the time is, I don't know. Like, I didn't have anyone affected by that, or I don't have anything. But it's like, why do we wait? Why do we wait until someone is affected or there's a different health issue, like you said, like you had, or, with me, I have lean PCOS. And for this past year, I have been just passing out left and right. I really have, not
Oh, wow.
understanding that I'm not supposed to eat sugar. It is my worst best friend. I had no idea, but you go into the doctor and they tell you birth control, birth control, birth control. And it's like, I don't want birth control. And so you're trying to be this. Again, there's just so much. And so I hear it, and it happens in so many other ways, but I was that person. And it's like, we wait until we're that person or we come close with a person to finally get that, humanize, I guess, is what puts us in. And so
Yeah.
I really want to sit there and say, like, even doing this, I'm no perfect. I would look at people and be like, why don't you just go do it then? And like, not realizing I've also, to piggyback this and even to cancer, is a lot of breast cancer patients, some of them don't even lose their hair. And you wouldn't even be able to tell. And you
Yeah.
don't know that. I don't know if you told me that.
Yeah, I think we did. We had the discussion about stage 4 and how when people look, stage 4, you often don't get chemotherapy. You take maintenance therapy, which attacks the cancer, right? And protects your body. Um, and oftentimes, most times with stage 4, you don't have surgery. So you didn't have surgery, you didn't lose your hair. You look the same, and people see you and they're like, oh, you're doing great.
Yeah, no.
And you're living with a disease.
Yeah, and
Um,
it's such a walking reminder. I mean, I'm so
mhm.
happy you brought that up because it's such a walking reminder of, seriously, you don't know what people are going through.
No, you
And
don't.
people really don't know cancer. They really think of cancer and they're like, oh, death. No, there could be that person right next to you who literally has cancer and you have no idea. Just because you don't lose your hair and you're not bald and you don't lose weight and all of these things that people perceive to be with cancer does not mean that they are not walking with the disease. And I know someone right now that's had cancer for 10 years. Has just been
Yeah.
living with it. And so they got to take a whole bunch of pills and do these things. And her life is harder in other ways, but it's just, man, humans are just ugly, pure point blank. We need to be kinder. We need to have more empathy. And like, I'm like, pure point blank. And it's true. I actually just went to church and they were just literally like, he was like, y'all are just nasty. He goes, we all have flaws. And he made us write down flaws. And again, this is now going to piggyback on other things, but we do. And so to now let people know cancer is so much more. It's so much more. And there's so much out there and we can change it and we can not make this such a lonely community. Like people really need to know, like they are not alone. Whether you have gotten cancer or not and you just lost someone, I had to remember that of just losing my brother. I thought I was alone. And I even come to find out, starting Courage Unfolded, I am not alone. There are so many people that can resonate with me. There's so many people that get it. And I couldn't do it without you guys. Like in me walking and literally my passion is seriously because of you guys, is of the stuff you guys have created. If none of this was created, it would just, hey, can you grab me a charger? Thank you. I don't know. This isn't, sorry. I just saw the 10% right there. And I don't want that. Yeah, grab him. Thank you. Sorry. Just
Fine.
we're gonna I lost my train of thought right there. But anyway, we really, I think really need to just start asking because cancer is not death. I hate it. I hate it so much. And I hate when people get on the phone with me and they're like, Katrina, I was healthy and da 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 da. And I'm like, that's great, but cancer doesn't mean because you were healthy, you're not going to get it. And so, oh yeah, that's what I was saying. That's what I was saying is we're not alone. I felt all of those same feelings. And so
Yeah.
people really need to understand that they are not the only one.
100%. 100%. And you feel like you're the only one.
You feel
And
like you
even
really,
if but I do want to say too, different cancers have different treatment success rates, right? And overall, breast cancer is pretty high. It's like 95%, right? It's 99% for early stages and down to like 35% for 5-year survival for people with stage 4. So it runs the gamut. But there's over 4 million breast cancer survivors living in the U.S. today.
This is going to die. Yep. There's 4 million. I'm so sorry.
No, you're good.
Yeah, there's 4 million breast cancer
survivors living in the U.S. today, right? So,
wow.
I mean, the survival rate for that is huge, which is why there's so many people that need the information that myself and other people are trying to
bridge out there.
To bridge out, yeah.
Yeah. Wow. 4 million people. That's so crazy. That's amazing. Does that number? Wow. I mean, that alone, I think people need to hear. There's 4 million breast cancer survivors, if not more, today in 2020.
In the U.S.
In the U.S. That is beautiful. I mean, amazing. I mean, just even we can knock out one cancer. That means the rest are just to come. The rest are just to come. I mean, what amazing that all of our human brains and research and all of these things coming out can really, I mean, that's a lot of people. That's a lot of people. I mean, wow. I know.
So I always laugh inside when I talk to, people in fitness or people, and they're usually, well, let's just say people in fitness or orthopedic. And they're like, yeah, we don't see those people. I'm like, 1 in 8 people, 1 in 8. I bet you do.
I bet you do. I agree. And I actually should, speaking of that, breast cancer is very high in my family. My aunt actually just got diagnosed with it. So I am going to be reaching 25. I'm going to go and start actually doing all of my testing. Just let alone having brother not dying of breast cancer, obviously, but of just cancer alone. And so I think, speaking of myself coming from a very high family line of cancer, please, people, do your health advocate, be your own health advocate. I do think even if you don't have a family history of cancer, go get checked, go do the things that you need to do. I think it's so important. I think people, again, they perceive as, oh, I don't have a family line of cancer, I'm not going to go do these things, because cancer has been perceived as this like one thing of a plan, and it's like, it's not that anymore. And I think that if you don't have a family history or anything, still be your own health advocate. If you feel that you want to go do that, go do it. Don't let anyone stop you. You might carry the gene, you might not. Who knows until you go do it.
Right.
So I have to go do that, actually. It's super important.
Yeah. And most people, when they think breast cancer, they do think hereditary, but only 8 to 10% of breast cancers are hereditary. So it's not that often. It's not as much as people think. And there's a cool, and I'm not going to remember the name of it right now, but there's a really amazing newish tool that the oncologists have where they can plug in your age, your ethnicity, anyone in your family has had breast cancer, ovarian cancer, and they plug in all these things and they pump out a percent. That's your risk. So that is a tool that's available. So for people, if they're listening and they don't know, well, like my aunt had it or my grandma had it, I wonder if I should get tested. Go to your oncologist. Learn your risk. It takes 5 minutes for them to run that.
Wow. I'm going to make that my reel right there. It legit, that was beautifully said, because it does. It takes 5 minutes. It's just people don't want to do it anymore. And then, it's always, it's not going to happen to me. It's not going to happen to me. I call these Katrina things, because I'm like, when people say that, I'm like, don't think that. I thought that. And it can happen to you. It 100% can. So let's try to reach it before it doesn't happen. Again, being your own health advocate in 5 minutes. I mean, I'm sitting here and I sound like a hypocrite. I need to go do it. So I'm going to go do that. I sound like a hypocrite right now. I'm like, Jesus, that's not
You're
good.
just learning. This is stuff that a lot of people don't know.
Yeah. And again, I don't know. And I'm never going to, I don't ever want anyone, I'm never going to perceive that I do. I know what I know because of what I've been through with my brother and that type of cancer. And then that alone, I still don't know enough about it. And so that's really why I've had this in my back pocket for 5 years. And I'm like, do I really want to do this? And I do. I'm doing it. And so
it's amazing what you're doing.
Thank you. I've had so many calls. It's shown the amazing and it's also shown the ugly. 100%. It really has. I've learned so much. I really have. And I'm going to say this again for everyone. This has not been rainbows and, butterflies and sunshine. There has been ugly, and there is ugly out there in the world. And I don't want people to think that there's not, especially in the cancer world. There's good bad doctors and there's a lot of bad doctors. And it's just finding the right, and I say bad doctors in the sense of we're human, greed, things. And I've experienced it a little bit just in my own and also within just starting Courage Unfolded. And those people will know who they are. But it's just, I'm calling people out now. I'm just not afraid. I've been through too much. And if I am going to leave this world, it's going to be on honesty and empathy and real. Because if that's what we got, I mean, I'm going to hold it, and I'm going to walk in that faith, in that hope, in that realness.
That's
It's
beautiful.
gotten me, yeah, it's just pure point blank said. And so I've seen a lot of good. And I think that even with all that ugliness, Dr. Renata, there's so much good. And when that
There's
ugliness,
so much.
so much, when that ugliness has been knocking out my door, whether it's an intro call, whatever it is, I just feel even more grateful. So I'm like, bring it on, like it makes me feel empowered. And like, that means the voices that are coming on my show are going to even speak that much louder. And that's what they're showing me. And it's amazing. It's all your mindset. So anyway, getting into, do you care if we go like 20 more minutes just because of the lateness? And yeah. Okay. So with clinical insight and the system thinking. Okay. So we've really broke that down. Okay, so we're going to go to the human experience behind the science. I have here beyond function and mobility, what emotional or identity shifts do you see survivors struggling with most?
Oh, that is a great question. There's a loss of identity, right? I've worked with moms that are breastfeeding their kids, and they either finished it knowing they had cancer or had to stop, right? It's a loss of identity. Like average age for breast cancer is, I believe, early 60s. I've treated people 24 to 92, right?
Wow.
Whole range of identities. But wherever you are, you're like, okay, I'm a 50-year-old woman and I'm a mom of 3 kids and I have a job doing this. And that's like your path. You're on this path this way. And that's the way you're going. And all of a sudden you have cancer and you have to stop working because you have treatments all the time and radiation every day. And the chemo's making you sick. And then all of a sudden you're on this path. And you're like, wait, who am I? Because this is where I was supposed to be, right? So there's oftentimes a huge loss of identity. And the emotions range, it's the whole grief thing, right? You can be angry, you can be sad, you can be withdrawn. I can't even name them. I'm not a relationship person. I'm not like an emotions person, right? But I've seen every emotion walk through the door.
Funny. Yeah. But it was just really good to not be in this side of what you're doing, by the way, because if you were, I think you would be very emotional through everything. Anyway, go on, and.
Yeah, no. But I do think, and actually as part of what I do when I consult is I do teach some of that you have to address the emotions. I did one reel on my page on socials where I talked about somebody might come in, I come back to the shoulder, but somebody might come in and she's pissed because her shoulder hurts and she's angry. And you know why she's angry? She's angry because she just got through breast cancer. She's angry because she lost her hair. She's angry because she has to come to PT when her cancer treatment's done and she just wants to go back to her life. She's angry because the person and the activities that she thought she was going to do this summer, whether it's swinging a tennis club or pickleball, which is all the craze out here in Minnesota, or, like swimming or golfing. She can't do that because she can't move her arm and she's pissed because of all of it. And why did it have to happen to her? Right? There's so much emotion in there, but she comes in and she's like, my shoulder hurts. And then they look at the shoulder and they're like, your shoulder's fine. And,
it makes you angry. And every right, she has to be angry, And so who's she going to lean to? Obviously, thank God you're there. But like, again, she has every right to be angry. And I think people need to hear that is like, your feelings are validated.
100%.
Feelings are validated, especially, I love that you said that because yes, watching, in my own experience, I watched my brother get angry because he couldn't unwrap a chocolate bar, and things that humans should be capable of doing is getting taken away from them. It's not just the scientific part. It's not just waking up and going, oop, I made it to chemo today. Like, no, it's literally, it's taking so much from you. And yes, that emotional side. And I mean, I'm going to say it, and like you right now, it is validated to be angry. It is validated to have
100%.
those emotions. People need to hear that. They really do. And it would make me angry that she couldn't swim anymore. And I just, she just goes in my prayers. I mean, all of these people are just, again, I'm hoping that it comes out, positive on the other end.
100%. And I do want to say, when people come in with that, when I say she can't swim anymore, most people that I talk to, they get back to, which is the beauty of physical therapy. And there's my little push for physical therapy or occupational therapy, especially if you have somebody that's trained and knows what the side effects of treatments are. I have people that went back to everything from like the trapeze with the ropes and stuff, to
Wow.
kayaking, to canoeing, to doing triathlons. Like, you can go back. You just have to know your limits, and you need to see the right therapist who understands this. Because I love the therapist that said, Renata, like, I don't do this. But then know somebody who does
Correct.
and
Yeah.
refer to them.
Yeah.
Right.
And that knowledge that, fine, if you don't want to do it as your human self because you went to school to go do this or whatever, again, I'm not knocking that down.
Right.
You went to school, you did it, you did the 8 years, you did the 4, whatever that, came to be in what you wanted to be, of course, in your degree and things like that. But like, yeah, I agree with you. Know somebody who does then. It doesn't take hard. The resources are on the internet. The resources are there. I think that, again, they are there. It's as easy as looking them up. I've sit in my studio apartment, and this is where I don't play a victim, and this is where I have a hard time looking at others and going, well, why couldn't you do it? You can't it took me 30 minutes. I just looked up breast cancer survivor on LinkedIn. I just breast cancer this, and I found you. And I'm not saying it's always going to be that easy, but it is that easy in the sense, maybe not finding you, but finding another person. And it's
easy to find me now.
Yeah, it's easy. Exactly. There you go. No, we're going to make it. And so like it really is though. And so it's, do it, it's just getting on that computer and doing it and carrying, again, that empathy just a little bit more, because knowing that's great that you went to school and you did these things and you can help, but you can't do everything. And knowing that and accepting that as just a human being, as a doctor, as a clinician, yes, a researcher, as, someone who lost, a cancer patient, anything that has, the niche in dealing with cancer, or just anything in life, actually, you can relate this to. Anyway, yeah. I really do tend to ramble. I always say this in every episode. Everyone's like, well, that's why you're on a podcast.
Another thing I want to, like, when you talk about emotions, I want to talk about the people that came in too and were so thankful and so grateful that I felt like they did more for me than I did for them.
Yes.
So it runs the whole gamut, from somebody that doesn't want to hear anything and says yes to everything you say because they just don't want to even associate. They want to dissociate, to people that like cry when they walk in the door, the woman that cried when I put the gown on her, to people that are angry. Like, it's all of the emotions.
Yep.
That show up. And I think we just need to meet people where they are.
I agree. I couldn't have said even more better, just because whatever the case is does not mean we need to, I don't even want to use such harsh words. Just meet them where they are, care a little bit more. I think it's just pure point blank. And that said, and if we can get that back, I'm not saying, again, we have a cure and we're going to cure that cancer patient and like that's going to fix it. But like, I think it's going to help the support, help the mind, help, a lot of things to make it a little bit more stronger, united, not so lonely, because it doesn't have to be. And so, yeah, I mean, leaving that one at that, it just doesn't have to be. And the more we spread that, the more, your organization is going to go. And I'm going to send your website to Hannah. I don't know why I didn't think of that. And I think I'm going to like create a resource page on my website. I've really been thinking about it. And, whatever, I'm obviously going to get consent from the people that, say it's okay. But I would like, obviously don't answer this now, but I probably will email you and use you as a resource.
No pressure.
Yeah, no pressure at all. No, I'm just kidding.
No, I would love that. And I think, the social media pages, the website was written, when I first started this, I mean, it's not like it was that long ago, but just a couple months ago. But even since then, it's really evolved. So a lot of the the real authentic messaging. Yes, the website says what I do. And it's great. It's a great resource. They did a great job. I hired out for that. I am not responsible for that. I give credit where credit is due. But a lot of the thing that I think resonates with people is that I am authentic. And I don't know if that's how I was brought up or if that's me from New York or that's that we have no time to BS about this. Like this is serious stuff. So
Yes.
let's just give you the information you need. And so those reels are the ones that I have 3 now that are over 200,000 views, ones at 2 or 260.
Wow.
It's amazing. And again, because I think I try to be authentic and real. And this is information that if you were my best friend, Katrina, and you're sitting next to me or you called me right now and you're like, Renata, I was just diagnosed, which I hopefully never happens to you.
Yeah.
Then, and I wish it never happened to anybody. These are the things I would want you to know. So here they are because you deserve to know them.
No, and I love that. And it's what I take with it, what I want to do with it. But at least
100%.
Here it is. This is, I'm putting it out there and we need more of you. We do. And I'm not saying that it's not, this world's ugly. I'm just going to say it like it is. It's not just because of what I went through with my brother or not. I've seen it in so many just different ways with different cancer patients, not even just my brother. And it's not hard. It seems so hard, but it's not. And I think yeah, go ahead.
I love clinic. I treated thousands of women in clinic. I trained therapists so they could treat thousands of women in clinic and men. But this message and what I'm doing now is because I left clinic, right? Because I have the freedom to say this. Not that clinic was holding me back. They were amazing, right? I loved it. I wouldn't have done it for 20 plus years. But when you said that, it just reminded me like I wouldn't be having this conversation. And some of you, most people that listen to this, they won't know I'm hiking Mount Kilimanjaro with Sean Swarner, who's a 2-time pediatric cancer survivor and has climbed the highest peaks on all 7 continents, North and South Pole, Hawaii Ironman on one lung, right? And he started this cancer climbers organization. And so me and my fiance and 4 other people were going to climb up with him in July. That wouldn't have happened if I had stayed where I was. So I mean, number one, it's just an encouragement for anybody who has more to say and more to do. There are people that want your information.
Yeah.
So say it. If it'll help somebody, say it.
Say it. Yeah, you're right. You're right. There we go. I mean, you just couldn't have said that any more beautifully. And like you hiking, by the way, is going to be amazing. I'm so, you're doing it in July. Wow.
Listen, I'm a little scared.
You go, girl. I was about to say, I would be terrified. And no, you got this though. Don't be scared. You got this. You are power. And you have no idea. Like that is such a blessing to be able to go do that and take that and learn. And I mean, already, but like, that is exciting. That is exciting. I feel like I've seen a post from an organization from this guy.
He's all over the place.
Yeah, I swear. I think it's with one of the organizations I've been working closely with, Polytactic Foundation. I swear, like I'm literally going to go on their Instagram. I'm doing it. Hold on. Is it this guy? Hold on. Just didn't take me 2 seconds to do it. I don't even know why.
And I would say too, and I don't know if this you can go on or not, but we're bringing the names of people that want cancer patients. What is it?
Yeah, it is.
That's Sean.
Is he like kind of white?
I can't see. Sean Swarner. Is that him?
Did they? No.
Somebody else.
Mark Allison. It's Climb for Life, One Mountain, One Mission. Okay, nope. I see.
It's another one, but I'm going to write that one down.
Yeah, write that down. There we go. See, hey, we're learning something.
I know.
Okay.
And I'm going to write the other one on a personal level. If you want me to take up the name of your brother, we're writing names of survivors and patients on a flag, and we're bringing it up to the top of the mountain. Off camera, you can let me know.
Yeah, okay, I will. I'll let you know off camera. Yeah, amazing. Okay, wow. See, more people are doing stuff. Wow, okay. I'm learning, see? Like I was just trying to connect those two together. I really was. I swore I saw that on Polytactic Foundation, but no, that's another one. But I want to read into the guy that you said. And so I'm gonna read into him and learn his story a little bit more. because again, it's all knowledge. I mean, you just taught me something right now. And so there's nothing is impossible. And I think people just need to hear that nothing is impossible. And this world is so, so beautiful. It really doesn't have to be this death and this ugliness. And there's so much to it. I mean, you're about to climb a mountain. Like, what? Like the most iconic, amazing person. I mean, we're all amazing, but like, again, what he's beaten and what he's accomplished is on another level. And again, not saying, I don't even know how to word that. His self alone has accomplished a lot, as you're going to accomplish a lot, of course. But I mean, that's an honor. You got to let me know how that goes. I mean, even just write me an email. I'll write you an email and be like, how is it up there? No, and I'm going to be praying for you. You're going to be safe. You're going to do amazing. You're going to rock it. I'm sure I'm going to see pictures somewhere, LinkedIn or
You will.
Instagram or something. And so I'm even excited. I'm going to look out for that. And so I can't wait to spread it. And so that's going to be such an amazing achievement for yourself. And so you were just rocking it this year. Like you really are. And it's just going to keep going up. It really is. And it's going to go up in the sense of your more success is going to be in ways that is the right way, because there's so much of the wrong way. And we all know that. I mean, you guys all know that. Everyone knows that. But it really takes one to come out and step and do something the right way and have success off of that. I mean, you're a light, Dr. Renata. And that's all right there. It's just a light. Simple as that. It's like God created us for this reason. And you're walking in his power. You're walking in his strength, all of it. And so it's amazing. Sorry, I am very religious.
You're fine. You're fine. 100%.
Yes. Okay, so I want to, obviously, before we kind of end this, I want to ask a few questions on the education side of it, and then the recovery I want to get into. So the education, this one's coming. This would be perfect for, I think this would be perfect for what we started out with. What should entry level, clinicians or pediatric side, I want to say, be trained to recognize immediately when working with cancer survivors?
Yeah. So I've started to create course and education on this, right? Custom and otherwise. And I think if you are working with a cancer survivor, like I said before, mine is for breast cancer. I was asked, well, why don't you talk about other cancers? And people got really mad at me. And I said, because cancer is such a big topic. And I know this much about breast cancer. I'm not going to say I'm an expert at something else because I'm not, right? So I got to stay in my lane. Staying in my lane. If people knew to look through what I call, and what we'll get out there, is a breast cancer lens. What are her emotions? Where is she standing? What is she thinking? And what are, I'm not going to go through the whole thing, but what are the things that she believes to be true that maybe are not? What she's holding herself from moving or thinking or exercising or lifting weights or anything like that, because she's been told that it's not good for her. I think there needs to be some basic education, ideally in every rehab school,
100%.
about these are the side effects of cancer. I had an education that was amazing, but my oncology was a 2-hour lecture by a doctor that went through, this is leukemia, this is lymphoma, this is, testicular cancer, and I was like, fact after fact after fact, and the application wasn't there. I want it to be applied. If you had this treatment, if you know nothing else, if you had radiation, your patient's probably going to be stiff in that area. It's not rocket science. I mean, it is when you go down to the levels that go over my head. But basically, if someone that is a entry level, they need to know at least it's not just about losing your hair, right?
Yeah.
It's not just about losing your hair. It's not about, like I was going to say earlier, if you look recovered on the outside when treatment ends, it doesn't mean you're recovered on the inside either, right? You have scars, you have a fear of lymphedema, you have lymphedema, you don't know what to look for lymphedema. Now I'm going off on a soapbox, but essentially I think it's really important that every provider understand the basics of the side effects of the cancer treatment that they deal with. End of story. Chemotherapy, certain types, taxanes, they might have neuropathy. Well, then make sure when you're giving her stuff, exercises in the gym or exercises in your clinic, that you're aware that she's more likely to lose her balance. You know, there's really easy things that we can teach, and I'm super excited to get that out there.
You have no
After
idea
Kilimanjaro.
how amazingly beautifully said. I mean, you speak very well, let alone, but that needs to be said is like, know the symptoms, know what, again, it's not just the science side of things. And I guess symptoms are the science side of things. And so it's just letting people be aware of that because you're doing them more harm, in my opinion.
Yeah.
You are. And so, again, it's not cancer or anything, but my PCOS, if someone would have just let me know, that doctor, like, hey, birth control, yes, is one way. But by the way, there's this diet that comes with it. Now, look, I don't know much about the diet that comes with it because that's not my side of things, but this is something you might want to go get checked out by being diagnosed with this. Like, even if doctors just say that, it gives me now a choice with what you diagnosed me as a doctor, now to go figure out the side effects, the symptoms, and the things, and to where it doesn't get to the point where I'm on the subway and I'm hitting the floor and whatever the case is. Yeah, no, it's been terrible. It really has. And again, it's not cancer or anything, and I don't want anyone to think that I'm comparing it in that sense, but it's been a rough year. It really has. And I've been diagnosed with PCOS since I was 15. I'm almost 25, and nobody has ever told me anything besides just take birth control, birth control, birth control, birth control, birth control. And I'm not going to sit here and play a full victim. I really do trust doctors. I do. I don't know if it's just me. I really do. I go to the doctor and they do the test, they run the test. I'm trusting them as myself, as my human self, as that's what I do. I didn't go to school. And so when they're telling me birth control, when there's actually a lot of things with birth control, anyway, just going to get off topic. It's been a rough year in the sense of if doctors would just come to you and go, hey, I'm not very experienced in this. I know that there's a diet that comes with this. You might want to go check someone who knows a little bit more about it, and kind of say with cancer patients, hey, I know about radiation. This is what I went to school with. Boom, boom, boom. When it comes to the chemotherapy side of things, you might want to, go over here and do this. And I think if it just bridges that empathy, it always goes back to the empathy and just the gap. It seems so hard, but it's really not. And I'm not saying here that you have to get, emotional with every patient, or connect, and because that's hard as a doctor. I can only imagine, especially if that cancer patient does pass. I mean, I can only imagine. And there's that other side of things that, doctors have been talking about, and that's hard. And so that side I'm never going to understand because I'm not a doctor. And never been having to tell someone like, hey, I can no longer treat you. But I think there is ways that we can do it differently, as both humans and doctors. Goes back to that gap. So so you answered that's the entry level. I mean, beautifully said. And I really hope people that are starting to become doctors or going into school really do take that. I really do. I hope you guys do, I guess. And so you've worked with thousands of breast cancer survivors. What is the pattern in their experience that still surprises you?
I think the second that I think I'm not going to be surprised is the second that I need to start thinking about hanging up my hat. If I think I have the ability, I used to say like, oh my God, this patient's going to do great. Oh my God, like this patient is going to, I've had really angry patients, you know what? And those patients I've like grown the closest to, because when they finally open up and we finally get to it, I can't predict any of that. I mean, I can tell you, like, I can predict when I know what their surgery was because of all the years of experience. When if their surgery and the kind of radiation they had and how many lymph nodes they had out.
So cute.
I can probably predict how they're going to move. I can probably predict pretty close how their motion is.
Okay.
I can't predict what's going to happen with that. because of the other things that I can't predict. Are they fearful of moving? Are they grieving? Are they scared to move? Are they going to do too much? Which is, I've had to hold the reins on so many people because, like, I had a patient once who she was 3 weeks post mastectomy, and she's like, I'm going to do a triathlon this weekend, which was 4 weeks. And I'm like, don't tell me that.
Yeah,
And no,
what?
I just made her promise that she wouldn't fall off her bike, and she didn't do the swim because of the risk of infection, but she did it. So you have people all across the gamut. And I think the second that I think I know what I'm doing, then I can predict how someone's going to act is the second that I need to seriously step out of it and
It kind of goes back to if you can help that one.
you can help that one. You can help that starfish, right?
Yep.
Yeah,
Starfish.
I'm always surprised. I guess that's the short answer.
Yeah.
I'm always
And
surprised.
it's you sometimes too, you know, and things that you're only human as well. You know, you are. And some things, again, even you doing this is you're not going to understand. And it's, you think, like you said, one thing and it, boom, surprises you. And you're like, wait, okay, that was not what I expected. And that's okay too. And that's okay to have your emotions as well. Just, I tell people all the time, just because you are not diagnosed with cancer does not mean that your feelings are not validated, because there is so much that is affected by cancer. And you just, if you can just help that one, that starfish, it just goes right back. And so it's just a big reminder. And she did it, and you know, feelings or whatever, but there's that one. Let's just, yeah. With that, you often emphasize function and return to life, not just, yeah, I know I have like 3 questions. Okay. So she's just so good to talk to. I can't help it. This is the longest podcast I've actually had. So
That's great.
okay. So we're going to kind of, so you often emphasize function and return to life, not just symptom management is what we've been really talking about.
Mm-hmm.
But what does a successful recovery actually look like in your model?
Oh, this is such a beautiful question.
I've thought really hard on what I wanted to ask you. I'm like, okay, because it's so much to talk about, but I'm like, I gotta bridge it in.
Yes. So successful. What word did you use again? I want to make sure I use it. Successful.
Yeah. So you often emphasize function and return to life, not just symptom management. But what does successful recovery actually look like in your model?
Yeah. Yeah.
Yep.
I'm going to start with one thing and then I'll go into it. So what I say, it's on my website, it's in a lot of my copy. And it just kind of came to me because this is what I think it all stands for, is that quality of life in breast cancer survivorship should be an expectation and not an afterthought. Right? So what that could mean for my 34-year-old woman that had a brand new baby is that when she was bending over in the crib to pick up her baby, this is the one thing she wanted to do. It hurt because she had surgery on her chest. So when I taught her to use different muscles to do it, it's not magic, it's science. She was able to do it, right? I have an 82-year-old woman who all she wanted to be able to do was downward dog. So I have a picture of her doing downward dog in the clinic.
Love that for her.
It was awesome. You know, I think everybody's idea, it depends on what your goals are. And that's what's so important, is that your recovery, successful recovery really depends on what the person wants out of it. My goal is for you to get back to doing whatever it is that you want to do.
Yeah.
Understanding if there's precautions that you have to take and what you should do about it.
Yeah.
End of story.
Your choice. End of story. Yeah. Wow. I really thought of I don't know why, but I love to, like, when I'm writing these questions out, I'm like, I wonder what they're going to say. I think they're going to say this. And I love when I'm wrong. Love when I'm wrong. Because
what did you think I was going to say?
I thought you were just going to say, like, successful, breast cancer survivor is someone that's kind of, again, what we think this world is, going back to, working your job and just kind of doing the normal things in life. And I thought that's what you were going to say. Truly, I'm I am the most honest, blunt person ever. I am a Capricorn for one, so those are my Capricorn girls that know, or Capricorn, people. We're hard headed and we are stubborn. Yes, I'm a psych major, so I love the signs and everything. I believe in them so much. And so it's very hard for me to admit when I am wrong. Let's just say that. Or I'm a blunt
I have
person.
no idea what you're talking about.
There you go. There you go. But I really did. I thought that you were going to sit there and say, like, a breast cancer survivor is someone that is getting in their car, going to work every day, and kind of getting back to what we call normal. I'm doing this because they're normal from before. And I really actually, you really did hit me in the face in the sense of, not literally, but like, you really did made me realize that when you get cancer, it's not that you're no longer that self that you were, but you are going to be a new person. Does not mean that cancer has to take everything from you. When you survive it, you are definitely not that, you're just not that same person that you were before you got cancer. Your life has changed. And you slapped me in the face with that one, in the sense of, like, it's not. They really do change. And there is things that come afterwards. And again, something I don't know. My brother didn't survive. And so I wouldn't know. And so there's so much that I'm learning, and so much, again, I like to kind of guess the answers. I've never admitted when I'm wrong. So this is like the first episode I'm going to be like,
wow.
yeah,
That's
you won't
awesome.
hear it in any other episode. I was wrong. And
As long as I get to hear that I was right and I can show that to my teenage boys, I will promote you forever.
Forever. No, you are right. You are. And so you even taught this 24-year-old something to say
You
that,
hear that, guys? Sorry.
Yeah, did you hear that? Yeah, listen, guys, your mom is right. Your mom is right. Listen to her. But you are. And I think even if I can sit there and say that, it really just showed me a little bit of, like, all right, Katrina, you got to look at yourself in the mirror sometimes. It doesn't matter about titles and who you are and everything. It's just, we're all human, and I've learned everything from episodes. So thank you for that. But you're right. Everyone's different. Someone wanting to do, what is it? Dogward style?
Downward dog.
Nice. I literally love that for that 80-year-old woman. That is amazing.
I love it. I have like 2 pictures of her doing it in the clinic, and I smile every time I see it, and I use it in talks and stuff like that.
That is awesome. What do you want to do before anything? I just want to do that. I want to accomplish that.
I want to do downward dog.
Yeah, amazing. I wonder what mine would be. I got to really think about that. I don't know. I have no idea. I'm really afraid of heights, so I think that, like, I would have to jump off of, like, no, I probably wouldn't do that. I don't even know where I'm going at with that. Anyway, bubbling right now. Anyway, I'm a trip. I am such a trip. It's insane. Okay. Here we go. How do you define let me know if this is kind of the same question, but how do you define progress for a survivor when traditional rehab benchmarks don't fully apply?
Yeah, no, I think actually it's a great question. So recovery, most people know, is not always going to be like this, right? You're going to, like, start to get better from whatever surgery or treatment you had, and then you're going to do too much, you're going to do too little, or the treatment's going to hit you harder and you're going to slide back. So it's always like this. And then you plateaus and then you go up. We always say that in rehab, right? It's like stairs. You do this. What's different working with cancer survivors is, again, things that happen with the side effects of the treatment. If you had chemotherapy, you're probably going to heal a little bit slower. If you had radiation, your tissues are more fragile. I'm not going to go into all of it. That's not the purpose of this podcast.
Yeah.
But what is different is that the timeline's often different. And so if you have a personal trainer or you have a clinician that's trying to push someone and they're not responding, they might think that the patient isn't trying or their client isn't trying and doing their work. But it might be that their brain fog is so much that they can't remember exactly how their form was supposed to do, so they're not doing it right, or that they did exactly what the trainer said, and the trainer or the therapist didn't know that they had a surgery that involved the pec muscle. It's a type of reconstruction. Or that they had radiated tissue that makes it more fragile, and they pushed them too hard and they got injured, and then the patient or the client doesn't come back, and then the therapist or the fitness trainers, like, why? Why are they not coming back? Oh, yeah, they're not adherent. No,
Yeah.
it's much more complicated than that. And that's why this information has to get out. And that's why I want to talk to trainers. That's why I want to talk to organizations about teaching their therapists and their trainers how to safely work with this population. Because, like I said, when you were like, wow, there's over 4 million breast cancer survivors living in the US alone. 1 in 8 women. Next time you go to a bar or church,
Yeah.
or whatever, wherever you go, right? Subway in New York.
Anyway, so
1 in 8. Right? I have a picture of me and my family at in Cape Cod. We used to go there for the summer. It's for like my grandfather's 80th reunion or birthday reunion.
Wow.
My aunt, I had circled it in red, was that 1 in 8. We had 8 women there. Right? So I digressed a little bit, but I just think the trajectory depends on what happened to the patient. And we need to take that into account.
No, we do. We do. I totally agree. I know are they knocking? No, I agree. I totally, hold on. What is that noise? Yeah, can you tell them to not do that?
I can't hear it on this end, by the way.
Okay. I'm like, what in the heck? No, you said 80 she was turning?
My grandfather turned 80.
Wow.
And they used to take us to Cape Cod, so we had a family reunion at Cape Cod.
Wow.
Anyways, yeah.
No, you're totally fine. Wow. That is, listen, anyone who reaches 80 that's just a great life to be living. But no, you're right. 1 in 8 women, there's always, and I'm going to go to like a church or something, and 1 in 8 women. Truly. So I never looked at it that way. I'm going to start looking, I'm going to share that. This information needs to get out. I mean, it's going to get shared, but I think even when people watch this episode, I really do, when they watch any episode and all, and they take something from it, they're actually going to start sharing it, you know, and preaching it or whatever you want to call it. And us as humans need to start understanding our voices and everything have so much power. And the knowledge and everything all needs to come out. And so you're speaking it, it's going to get out there. I know Courage Unfolded is going to work. I mean, I don't want to be negative about it. Like, I think
it's amazing what you're doing. I can't wait to see it. I can't wait to follow you.
Thank you.
Your brother would be so proud. I know I said that to you before in a prior conversation, but he would be so proud of you.
Thank you. No, thank you so much. And it's really nice to hear that, especially again, I'm human. You know, I might come on this podcast and I'm like, hey, everyone, I'm so excited. But there are some times where it hits you. It really does. It hits you in the heart. And it's like, oof. And, you know, it humanizes me a little bit, but I'm not perfect. You know, I did an episode with Garrett Coffey. You know, he's battling Ewing sarcoma. And we got done and I cried. Obviously, it was a connection with my brother a little bit. And I even said in his episode, I'm like, I feel like I did a little bit of healing in this. And so I think everyone's bringing me some kind of healing. And I think that's okay. And I think that's okay to admit. And I think that I hope to do that for a lot of people, that we all can. Because again, our voices can do so much. Knowledge, bridging gaps, healing. It really can. Support people that don't have support. I wish a podcast was out there. I had nobody. I had my mom, you know, and that's it. That's really it. No one else. I mean, right now I only have my mom, you know, my sister, a little bit, but like truly the support is so important. And for the people that don't have that support, I think needs to be that support. And so if I can do that for people, it's all, I'm doing this out of my own experience. This isn't out of something where I'm like, ooh, that, and ooh, I can do that because of this. No, this is all coming from my deep down heart. And I can't wait to see what happens. And even if it doesn't really go anywhere, I think I'm going to continue to do it. To be honest, Dr. Renata, like really, I really am. And it's something that I think is just bringing me some type of peace in my life. And so if I'm just doing this as a hobby, just cause, like, I'm all for it. I want to do that one starfish. that one starfish. And so
I know, it's a great story. It really is.
I'm literally going to tell Patrick about it, which you're going to meet him after this, by the way.
Okay.
So
Okay.
highly of him. I want him to come say hi. He is my, the business partner as well in this. And so I think it would be super important just to say hello. But he's even watched me in my I call it emotional roller coaster, and I've learned so much from you guys. I mean, I've learned so much even just this episode, and I'm going to take it and now I'm going to apply it. And that's up to me. And so everyone needs to know that's watching this that it's up to them. They have a voice. You don't need to be diagnosed with cancer or have anything to do with cancer to even watch and figure out what cancer is. And you just don't. I think everyone should. But there's nothing out there to really bridge it. And also too, I mean, my generation, they don't watch unless it's interesting or, they won't just listen to an audio, unfortunately. And so they'll just swipe over. And so we got to make it, to their liking. And that's unfortunate of the world, but we're going to do it. And I hope that it helps.
Play the game.
Yeah. We just got to play the game. Correct. I tell Patrick all the time, I'm like, you just got to shake the hands of the people sometimes. And as long as you don't lose yourself, you can create so much actual change in this big old world. It's crazy and it's beautiful. I really hope that made sense. Okay, so I'm going to kind of close this out. Because I know we didn't get through all the questions, which I knew we wouldn't, but I'm gonna, this is gonna be off camera, you can, answer this later. I want to have everyone that I had on series 1 kind of come back again on a later series, which I think is gonna be amazing. Is what I'm going to eventually do. And obviously there's going to be so much. I think people are going to, I'm going to create something where people can actually send me questions. And let's say someone watched your, your episode and they have certain questions. I want them to know hey, hopefully these people will be back on and I'm going to ask those questions because I really want the outside world to know we're listening and we're here to answer anything that they have. And so I kind of align that when that time comes, of course. But something that I really have a vision and a mission on with Courage Unfolded as well. This is going to bring amazing things. Anyway, I'm so positive about it. I am. I love it.
I love it. I love it. I love the passion. You believe in it and you believe in helping other people and you believe in taking a hard situation, a horrible situation with your brother. I am so sorry that happened to you guys and turning it into this where you help other people. It's great. I really commend you for that. I did not have that when I was in my 20s. Are you kidding me?
No, it's been rough. So thank you. I really appreciate that. I'm definitely an old soul. It's so crazy to sit there and say I'm almost 25 because I truly feel some way or somehow I'm in my 40s or 30s. I feel like I really lived generations of different lives. And I kind of am grateful for it. I think, God has I didn't understand it. I really, really don't. And I didn't. And I think there's some that I still don't, but I really am now. I'm all right, God, I get it now. And I really don't. I did that for a long time. I did. I played the me and I've been through this and there's no one there for me. And I wasn't always this passionate. I wasn't always this happy. I've been through that where I was alone and shaking and literal shaking and there's no one to grab me. And I've had those moments and whether I'm in hospitals by myself and sleeping in my car. I got to New York by sleeping in my car. I slept at truck stops. I did. I literally parked my car at a truck stop and I drove here for 4 days. I had about 10 grand in my bank account and I had nothing else.
Goodness.
And I slept in my car and I got here. And, got fired. There's just been one thing after another. Drove back, slept in my car. I made this drive 5 times in 1 year from Vegas to New York. I was determined. Nothing was stopping. I played that for so long of poor me, 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 me. And I'm man, I've been through so much. What am I going to do with it now? I have so much fire and so much strength. And I didn't even realize. And I never lost that light. And so I've really been reminiscing the past 5 years. What do I want? What do I want to show with people? And I've lost people left and right, this and that. And it's just been one thing after another. And I'm I don't want to do it anymore. I want to change generational change. And so that's what I'm trying to create within myself. And I want to take all this fire that I have and I really want to give it back to people. If there's nothing that I want so much more in this world because of what I've been through. I mean, you freaking name it. I mean, it's been insane. It's like call them little like Katrina things. It doesn't have to be anger. And I really want to show people that come from the hardship maybe that I came from, that they're not what their generation says they're supposed to be. They're not that. And people really need to know that. You can come from drug addicts. You can come from things and not be them. You know how many times I've been told you're going to be 16 and pregnant and be a drug addict? I'm like, yeah, okay. Like, watch me. And there's people out there that are like that. And they need more of the community and the bridging and know that they can make it happen. And if I can, everybody can. If you can, everyone else can. And so I've really, again, I think I've called it obviously pivot a little bit, but it's that fire. And this is all really coming from my heart and what I am creating. And I don't know what's going to come out of it. I have no idea. But I hope it can just help that one starfish. Because again, it comes from my own pain, my own hurt, my own past is I wish someone was there for me. I wish the resources were there for me. And I don't want anybody to be going through what I went through. I don't want anyone to sit there in their car and cry and feel like they have nobody, because that fucking sucks. Excuse my French, but it sucks.
I'm from New York.
Yeah, it's terrible. There you go. Yeah, it's just terrible. And nobody wants to go through that. And so I need to let people know, like, you don't have to. You do not have to, especially in the cancer world where it's so lonely. And so really kind of just like leaving it at that. Hold on. I think I have like a closing question. What do you want survivors listening to this conversation feel differently about themselves afterwards? And then I have legit one closing question and I am done.
Okay. So what do I want survivors to feel when they're done listening to this? That was the question?
Yes. So the question, sorry. Well, there's going to be two questions, but yeah, what do survivors listening to this conversation right now or afterwards to feel differently about themselves afterwards?
Okay. So I want them to feel heard. I want them to feel validated. And of course, I want them to feel empowered, right? So much is taken away when you're diagnosed with cancer, and so much is out of your control. And sometimes it's so lonely because you think you're the only one going through it, but you're not. Like, it's been amazing on my pages on socials. Somebody will say like, oh, I had this and this and this. And has anyone else ever had this? And then I have underneath, oh my God, I had that too. Oh my God, I had that too. Oh my God, I had that too. And then suddenly you don't feel so alone anymore.
Yeah.
You know, so I just want survivors to know that there is help out there, that you can feel better, that you can move better, that everybody is not trained in this. So if they went to somebody and they didn't know, they don't treat this, then go find somebody who does, virtual or in person.
Yeah, no, I agree. Wow. Beautifully said. Now, my last question for you.
Yes.
You ready? What does courage mean to you? I end it with this on everyone.
Yeah, that's a hard one.
There is no right or wrong answer. I think courage is such a broad openness. Yeah.
To me. Okay. So to me, courage is facing the thing that you're afraid to face, right? Courage is stepping outside your comfort zone and doing what you believe is right, even if people around you don't think it is.
Wow. So I love your answer.
Yeah.
I mean, I love everyone's answer, of course, but my slogan, and this is why I love your answer so much, my slogan is choosing truth before fear begs you to retreat.
Oh, I love that.
Yes. And so it's kind of piggybacking off of, I love hearing everyone's, what is courage to you? But the ones that get it very close to my slogan, again, this is not a right or wrong answer.
No.
It shows that's what courage means to me. That's why.
That's beautiful. That's amazing.
It is. I mean, obviously within my life, that's what brought me that fear, that speaking the truth. And I mean, I love that. That's what courage means to you. And so thank you for sharing that. It's very close to my slogan. So very awesome.
Yeah. And thank you for for the opportunity. I think it's fantastic. Like I said, what you're doing, if it reaches that one starfish, if it reaches that one person, or somebody else says, oh my gosh, I heard this. It doesn't really apply to me, but you need to hear this.
Yep.
That's amazing. So
It's
kudos
amazing.
to you and what you're doing. Keep doing it.
Thank you. No, and keep doing what you're doing. Won a 0.2 million over there. It's about to skyrocket. It's about to go to, 3 million, 4 million, 5 million. And we are going to change this world in every which little way that we can. We're one human, but if we can all, really align together, evolution, change is about to be made. I really believe that in my heart. And so continue what you're doing and know that you made the right choice. Not, every day is always not going to seem as easy. And it's not. Again, we can glorify this and the positivity and the things. It's not always that. And so keep going. Don't give up. I know you probably don't need to hear that from me, but I'm going to tell you anyway. Do not give up. You are
I can always hear that.
Yeah, no, you
I
are
can always hear that.
powerful. Your name and everything, generational change and within yourself and what you want to build. And what you kind of mark you want to leave on this world, and you're leaving one. And I can't wait to share that. I feel honored to share that. And so I feel honored that you came on my show. Thank you so much for, coming on and being here.